967. We are coming to you live on 10:50 a.m. KCHN, Houston, Texas. You also can listen to us on kchnradio.com. I am Dr. Nik Nikam, your host, and we will be right back after these messages from our sponsors. Hello, ladies and gentlemen. Welcome back to Nik Nikam Network Talk Show. I am Dr. Nik Nikam. Welcome back to Nik Nikam Network Talk Show. I'm Dr. Nik Nikam, and our second topic for this evening is going to be Ayurvedic medicine. In fact, we're going back way to India and talk about Ayurvedic medicine. And I have two special guests. And to my right is Dr. M.Swamy, and he's from Bangalore. And to his left, right. Right is Dr. Ravi Tamarisa, who is well known here in Houston, who is an anesthesiologist, is pain specialist. And we're going to be talking about the Ayurvedic approach to lifestyle diseases. First, we're going to find out what is Ayurvedic medicine. Then we talk about what are lifestyle diseases. And we learn a lot about Ayurvedic medicine. So let's welcome our guests, Dr. Swamy and Dr. Ravi. And welcome to Nik Nikam Network Talk Show. We're delighted to have you. Dr. M.Swamy, maybe you can give us a little bit about your background, and then we will proceed with the topic.
Yeah, I am Dr. M. from Bangalore, India.
Yeah.
See, I
Keep going.
I own a brand which is called Shatayu Ayurveda, which is a 114-year-old brand. We do a lot of disease management programs in India. And as Ayurveda is becoming popular worldwide, so we want to make it in a very proper and genuine way.
Yeah.
The traditional and authentic Ayurveda, I want to get it approached to the worldwide. So first approach we are doing in USA through Houston, because as everyone knows, the Houston is a capital city of the medical field.
Yes.
So we want to go through, and we have a tie-up with Dr. Ravi Tamarisa's pain management clinic.
I see.
And this 114-year-old Shatayu always believes in evidence-based complementary and alternative medicine system of medicine, because now is the era where we can't say that my medicine is best, that medicine is best, this medicine is best. Okay, so there should be a complementary medicine. So this is where we believe in. With that concept, we came into Houston. Now we want to start a first center in Houston. Then later on, we are spreading all over US. The San Francisco, Los Angeles is the next one which we are planning to launch. So hopefully, we are trying to do the very good approach of Ayurveda in a very systematic way.
Very good. While we are talking about Ayurveda, let's give out a little background about the central thesis of how Ayurvedic medicine works.
Okay.
In the modern medicine, as Ravi, who is also a modern medicine doctor, we talk about risk factors that lead to a particular disease.
Yeah.
Maybe you can highlight us on, what are the things that you think that causes disease, and then we'll approach how we diagnose and treat those.
Yeah.
Can I just say one word before Mr. Adrian Garcia leaves?
Oh, okay.
I appreciate Mr. Garcia, who has addressed the pain community about a year ago and addressed the downside to narcotics and the narcotic addiction, and the deaths that are being caused by the narcotic addiction and the sale of the drugs to minors and school children. And I want to thank him for addressing the community. I made sure that some of my patients came for his talk. It was a very impressive talk. After the talk, the patients knew that drugs can kill. Ladies and gentlemen, it's okay for us to keep on giving drugs, but it's not enough. It's not a service to the community. I think that Ayurvedic medicine can address body and mind and other things involved in chronic pain management. And that is the purpose of my approach to pain management in a holistic fashion. And I wish you all the best, Mr. Garcia, for staying over. We hope that we can keep the Houston community safe from drugs and drug abuse. That's the goal of bringing Ayurveda to Houston. Thank you, sir.
Okay, very good. Dr. Swamy, maybe you can highlight us on, what is the central thesis of Ayurvedic approach to disease?
Yeah. See, as everyone knows, even the worldwide, the Ayurveda has become popular for its preventive as well as prescriptive aspect of the lifestyle management. Especially Ayurveda is called a science of life.
Yeah.
Okay, it is not called as a medicine of life.
I see.
Right. So we always in Ayurveda believes more importance we give to the prevention than the cure.
I see.
So when we say prevention and the cure, there are two types of subjective goals of Ayurveda. So there are 6 stages of disease manifestation which we believe in Ayurveda. Okay, and Ayurveda always believes in Tridosha Siddhanta. There has been Tridosha theory that is called Vata, Pitta, and Kapha. But everyone nowadays knows I belong to Vata, I belong to Pitta, I belong to Kapha. But these 6 stages of disease manifestation, when we take it, see, other system of medicine believes when there is a disease set in, then they start the treatment. Whereas in Ayurveda, first 3 stages of the disease manifestation, they are called the predominant symptoms. Like before disease starts, those symptoms we can assess through a Vata, Pitta, Kapha variations in the body. So those 3 doshas.
Maybe you can explain these words, Vata, Pitta, and Kapha for the non-Ayurvedic people.
No, they are the physiological and the functional functions which happens inside the body. Okay, Vata in generally we can correlate to a terminology called it's a neurological functioning of the body. Whereas a Pitta we can correlate. Actually, it is not exactly only neurological function of Vata and the metabolic symptom functioning of the Pitta. And all the fluid part, whatever there in the body, we can take it as a Kapha. But it's a vaguely I'm saying you, but exactly Ayurveda believes in in-depth cellular level diagnosis of the diseases. Even the prevention aspect, whether it's a prescriptive aspect. So always we believe in those Vata, Pitta, Kapha. They are the DNA of the body. Like you are born with, you are born with some different body nature. I am born with different body nature. Dr. Ravi is born with different body nature. All the 3 we behave in a different pattern. So the all concept what we believe in Ayurveda is bringing equilibrium of those Vata, Pitta and Kapha, which are going haywire out of our bad lifestyle, bad food habits. So these are the things which are keep on varying in the body.
You want to give a simple example?
Yeah.
Then we'll proceed with the other things we are talking about.
Okay. See, for example, you say suddenly you get today after in a hot summer. Suddenly afternoon you feel that it's too hot. Okay, then you get a lot of irritation. You don't know what is this happening. Okay, you are just 2 hours back you are completely all right. But suddenly that irritation started to you. So what if you know your body nature, the Vata, Pitta, Kapha, accordingly you can balance it. See, it may be because of the dehydration. It is because of the too much of excess hot outside. So if you manage with your the balancing of the dosha in the body, so you will be cooler for the whole day. So instead of going into a panicky situation that what is this happening to me, why not to others, so you can manage then and there itself.
So instead of dealing with something that has already gone wrong, you're trying to see, maybe prevent it from going.
Exactly.
One step behind what the modern medicine does.
Exactly.
Somebody comes to the emergency room with fever, then you diagnose and then you treat. Okay, ladies and gentlemen, you are listening to NIK NIKAM Network Talk Show. We are talking about Ayurvedic approach to lifestyle diseases. And my special guests are Dr. Mrutyunjaya Swamy and Dr. Ravi Tamarisa. Okay, you were talking about Panchakarma as one of the other entities. Maybe you can expand on that one.
So the Panchakarma comes as there are a variety of treatments in Ayurveda. See, first I said you the disease manifestation, which is a preventive and prescriptive. Okay, when the prevention came that I explained you, when it comes to the prescriptive part, when a disease manifested already. For example, say a rheumatoid arthritis or a migraine or so many diseases. When it manifests, there are 2 types of treatments Ayurveda believes in. That is, one is purificatory treatment. Another one is a palliative treatment. Purificatory treatment comes when there is a excess dosha aggravation in the body. Okay, it has crossed the limit and it has caused a lot of destruction to the other body organs. So at that time we do a treatment called purificatory process. This Panchakarma comes under that. These are the 5 limbs of the treatments. So that's the Vamana, Virechana, Basti, Rakta Mokshana, okay, and Nasya. These are the 5 types of treatments which we adopt in that. See, for example, in any of the Vata cases, we adopt the Basti Karma. Any of the Pitta cases, we adopt the Virechana Karma. And any of the Kapha disorders, we adopt the Vamana Karma. And any of the head and neck portion of the problems, we adopt the Nasya Karma. Okay, and when it comes to the skin problems, we adopt the Rakta Mokshana. These are the 5 types of it's a very, very strong foundation of Ayurvedic therapies, which helps in eliminating the diseases. That's one of the part which Ayurveda believes in. Not only that, even these Panchakarma can be adopted in the preventive aspects also. When we are approaching a holistic approach, we are giving to a health and wellness.
How much does Ayurvedic medicine is similar to the modern Western allopathic medicine,
Okay.
and how does it differ? I'm not saying which one is better. I'm just
Okay.
saying, how does it simulate and look, different?
Okay. See, usually Ayurveda always believes in the herbal medicines.
Yeah.
Okay, which have a least amount of side effects. Okay. We also study a pharmacopoeia, and we study a lot of drug adverse reactions, and we also do a lot of researches on that. Already, see, in Ayurveda, because it's a 5,000-year-old, we see whatever the symptoms and the treatments are there, and whatever the results we are getting, almost like evidence based.
I see.
But still, modern science requires in their terminology. So now a lot of research are happening in Ayurveda, especially central government under the Modi's leadership is giving a lot of encouragement for that. And with Dr. Ravi Tamerisa, with the pain management clinic, we want to start with rheumatoid arthritis and a lot of autoimmune diseases in terms of establishing the result this one through a research paper publication. That's what we are trying to do it. But the medicine is almost similar. Okay, a lot of antipyretic. We also have a lot of anti-inflammatory. We also have so a lot of medicines we have. Only thing we give importance to the Tridosha theory.
Yeah, 1 second. Yeah. Oh, okay, ladies and gentlemen, we are talking about Ayurvedic approach to lifestyle diseases, and my special guests are Mrityunjaya Swami from Bangalore and Dr. Ravi Tamerisa, who is a pain specialist and anesthesiologist here in Houston and Sugar Land area. Okay, let's talk about, you wanted this to be titled lifestyle disorders.
Yeah.
Maybe you can explain to us what is the definition of a lifestyle disorder and how Ayurveda come into picture in treating these patients.
As the name itself says, it's a lifestyle diseases. Nowadays, a lot of lifestyle diseases and lifestyle disorders are rampant because medical field is so advanced.
Yeah.
Anything to do with the viral or bacterial infections, they have the remedy. Okay, anything, the enormous amount of pain a person is suffering, they have the remedy for that in terms of the advanced medical field. But when it comes to the lifestyle diseases, say obesity, diabetes, migraine, psoriasis, okay, and these are the stuff which are created by the lifestyle induced. They are nothing to do with the whether it's a virus or the bacteria. So those are the things are becoming very rampant. And nowadays we are seeing a lot of research papers publishing that US is becoming a capital of obesity. Okay, so we want to address those issues. So, but first initially we want to go with the pain because rheumatoid arthritis, a lot of pain cases we are getting. So those are the we want to do. But the lifestyle diseases are big. We want, because a slight modification in the lifestyle and the diet modification will change the entire scenario of the suffering. So we want to address this first. Because Ayurveda believes always in Swastha Vrita. Swastha Vrita means maintaining a health of a healthy person. That's quite an important aspect. So that introduction also will be very easy because it won't require any of the medications, only herbal supplements, some dietary modification, and some advices is more than enough.
Okay, ladies and gentlemen, you are listening to NIK NIKAM Network Talk Show. We are talking about Ayurvedic medicine in managing lifestyle disorders, and my special guest is Dr. Swami from Bangalore, along with Dr. Ravi Tamerisa, who is a pain specialist. Does Ayurveda believe in like inflammation or infection? You mentioned about infection and all this.
Yeah, it is there because as I said you, the Pitta is one of the things which deals in detail with the inflammatory disorders, right? So because that is the one which is responsible for the metabolic and catabolic activities in the body. So always there is one reference in our, because we have 8 branches in Ayurveda. The Kaya Chikitsa, which is a general medicine, Shalya Tantra, which is a surgery department, Shalakya Tantra is a ENT department. So we have like that 8 departments. In that, one of the department is Shalya Tantra. There we have seen an example or the reference of mentioning the Shota. Shota is nothing but the inflammation. Shota, and we treat that very effectively with some of the available Ayurvedic herbs. We have seen a lot of challenging results also in that. Yes.
Okay, before we go any further, maybe you can give out your purpose of visit to USA, and you talked about setting up centers here. Maybe you can tell us a little more about that.
Okay. See, now what happened, Ayurveda has become so popular everywhere. Even recently we saw WHO's survey saying that 80% of the US people are using the alternative system of medicine.
Yeah.
But a lot of people are unaware of that. So what happened? Ayurveda is misutilized in a wrong people's hand.
Yeah.
So you want to come with the authentic approach to the Americans. So now the Modi government, especially government of India, is encouraging a lot of things. The first step towards that was the World Yoga Day.
Yeah.
Okay. So now Modi government is approaching all the countries all over the world to establish Ayurveda as an alternative system of medicine. So with that effort, we are approaching here, and we want to make it a lot of authentic documentation when it comes to the research paper publications in Ayurvedic therapies and remedies. So that is the first basic thing which we want to introduce it through Houston. And this was the excellent opportunity for us, which Dr. Ravi has provided us to enter US through Houston, which is believed to be a capital of healthcare segment.
Oh yeah, Texas Medical Center is one of the leading medical centers. Not only in this country but all across the globe, and that's where we have spent better part of our lives. I'm a cardiologist, and I've worked at the Texas Medical Center for 35 plus years, so I'm pretty familiar. And okay, let's talk about on the top, since I brought up the topic of cardiology. Does Ayurveda believe in atherosclerosis or hardening of the arteries? Things like that.
Yeah, it is in Ayurveda also. We have a Hridroga, which deals with the cardiac problems. And it is clearly mentioned there also, the surgical intervention when there is a problem with related to the valves and the arterial blockages. It's very clearly mentioned.
Is that right?
Even the a disease set pattern also is mentioned, how it starts, how the dosha gets accumulated in the arteries, and what kind of a block it forms. When the surgical intervention comes, then we'll refer to the Shalya Tantra department, because we are mainly treating with the lifestyle diseases right now. So we have not done too much of work on that, but a lot of other field of our Ayurvedic doctors are doing quite a good with this one. One of my friend is doing only Panchakarma to get rid of the arterial blockages.
I see.
Yeah, excellent. This one we have seen it. So very soon we'll be introducing here that also.
Okay. Ladies and gentlemen, you're listening to Nik Nikam Network Talk Show. I am Dr. Nik Nikam, your host, and we are talking about Ayurvedic approach to lifestyle diseases. And my special guest is Dr. M.Swamy from Bangalore, and next to him is Dr. Ravi Tamarisa, who is a pain specialist. And Ravi, you want to say something about the Ayurvedic center that you are all planning to set up here, and how it integrates with the modern medicine we have lived all our lives?
Exactly.
Hold on, let me turn on your mic. Okay.
Exactly. We all grew up in our homes in India in 50s and 40s, without revealing our ages, but basically we grew up with Ayurvedic therapies in the house. Our mothers
still do.
Which a lot of people still do. And I think that they have less side effects. Having practiced Western style medicine for more than 40 years in the United States and dealing with pain management, I've realized the importance of offering our patients something more than just the drugs and the injections we offer. I think a lot of stuff is related to mind-body medicine. There is no question about it. They tell us that more than 30 to 40% of patients in chronic pain have mind affected with either anxiety disorders, depression disorders, or whatever else. Bipolar disorders, they have higher incidence of pain and what they call catastrophizing of pain. In other words, they have the exaggerated response to pain. So Ayurveda has not just herbals, but it has yoga and meditation, which we frequently forget that forms a big part of Ayurvedic treatment. And without having to have a psychiatric approach to it, yoga and meditation can take care of these problems. And I strongly believe that will change the way we practice medicine in the future. And that's my purpose of bringing Ayurveda. And I strongly believe there is a strong need for this.
Okay, that's great. Ladies and gentlemen, you're talking about Ayurvedic approach to lifestyle diseases, chronic diseases for that matter, and we're going to get into that detail just momentarily. And my special guest is Dr. Swamy, and that was Ravi Tamarisa who was just talking. Okay, Dr. Swamy, how do you diagnose a disease? You know, of course, we examine the patients, we do tests, and we come up with a differential diagnosis and come to a conclusion. How does Ayurvedic doctor approach a patient with the symptoms?
You know, I had a privilege to live with my grandfather,
Uh-huh.
okay, who was one of the founder member of this particular Shataya Ayurveda. See, when I was small, the people used to come. He used to start scolding them. What the hell you are coming now after so many years? You are suffering with this arthritis and you have this stomach upset and you have this chronic neck pain and all. Why you are coming today? So it used to be astonishing to see him that how come he knows? He's not an astrologer.
Yeah.
How come he knows it? Then after coming, then he used to do a pulse diagnosis. That's a Nadi Pariksha. After that, he used to tell the whole A to Z of that. Before that person opening his mouth. So then I was like literally shocked. How come he knows? What is that he's touching? That he's coming to know. But when I joined the BAMS, Ayurvedic course, it's a 5.5 years doctoral course. Then I realized what they teach in our curriculum. It's an in-depth analysis of a person. The person, the way he walks, the way he looks, the way his body is built, the color, everything will give us one idea what prakriti he belongs to, what body type he belongs to. Accordingly, we'll start gazing, we'll start analyzing the stuff. Then once we hold the nadi, then we'll exactly come to know what imbalance is happening in the body. Because Vata people will suffer with Vata set of diseases. Pitta people will suffer with the Pitta set of diseases. Kapha people will suffer with the Kapha set of diseases. And nobody is born with only one dosha predominant, because all the three will be there in the body. Only one will be predominant. So accordingly, he is built up, his body nature. So on that principle, we diagnose exactly what went wrong. Then nowadays, whatever the modern technological this one is available for us, like the X-rays, all the blood investigations and all, is coming us very handy.
I see.
Yeah. By the time we cross-verify those things, it's exactly matching the thing.
I see,
and for us now, more than the Nadi Pariksha, we're relying on this also now. So it's becoming easy for us to give that the management process.
So what do you actually find in the Nadi Pariksha?
Yeah. No, there is a blood vessels.
Yes.
Okay, with the 3 finger, we'll start feeling the pressure. Okay, the Vata, Pitta, and Kapha. So accordingly, we'll come to know which is more, which is less, which is this one. Then one more thing, what happens? Always Ayurveda believes in the person, which area he has born and brought up, and what kind of a food he is eating, and what kind of a lifestyle he is carrying, whether he is doing a work in the day shift, whether he is working in a night shifts. So everything comes under into a consideration when we are diagnosing any disease or diagnosing any discomfort in a person. Accordingly, we will plan the therapies which will help in management of the diseases. So we want to give a complete holistic and a very complete holistic approach to the health and wellness through this diagnosis type.
Ladies and gentlemen, you're listening to NIK NIKAM Network Talk Show. I'm Dr. NIK NIKAM. We are talking about Ayurvedic approach to lifestyle diseases, and my special guest is Dr. Swamy from Bangalore, and next to him is Dr. Ravi Tamarisa. Okay, let's talk about certain specific disease entities. Let's, for example, diabetes. How do you approach a patient with diabetes?
Okay. See, usually diabetes is one thing. In Ayurveda, we believe in 20 types of diabetes, whereas the modern science believes in only 2 types, type 1 and type 2.
Yeah.
So in Ayurveda, what happens out of those 20, few are the pre-disease condition.
Yeah.
Okay. So once we establish that condition, where we establish that disease, this one process, we can then and there itself we can stop that. But now what happens in the advanced cases, what we are trying to do is we are doing the research on that. We are recently published a paper also on that. So what we are doing is in the diabetes, Ayurveda believes that there are 2 types of condition which we have to immediately arrest. One thing is the insulin secretion, whether it is there or not, or the secreted insulin is getting absorbed or not. In both the condition, Panchakarma comes very handy for us. So any of the detox process, Panchakarma is nothing but the detoxification process. So one of the detox when we implement, so we can see a lot of changes in the HbA1c reading, even the FBS, PPBS readings. We are seeing a lot of difference in that. But we will never advise the people to stop the existing medicine and take our therapies or our herbal supplements. It will be a complementary. It will be going hand in hand. So the day their diabetic symptoms comes down, so naturally we can withdraw one by one. So that is how we are giving a complementary treatment to the diabetes.
I see,
We
yeah.
can't say that only Ayurveda will help in that.
Mhm.
So it's only a complementary thing. We have seen a tremendous changes in the diabetic
So
profile.
you're saying it may boost the efficiency of the other medications,
Definitely.
along with lifestyle changes, and maybe get a much better control of blood sugar and
Yes.
hemoglobin A1C, and
Exactly.
the other things you're talking about.
Exactly.
So what specific medications or Ayurvedic treatment do you have for diabetes patients?
See, we have anti-diabetic property drugs in Ayurveda, which are like dietary supplements. A lot of dietary supplements which will control the insulin secretion, even the absorption rate.
Yeah.
Yeah, even the pharmacological studies have shown the efficacy in the insulin secretion, even in the absorption rate. That's what we give a lot of treatment. This one, the one of the main drug in that is the madhu. Lot of anti-diabetic medicines are there, which we can utilize that.
Ladies and gentlemen, you're listening to NIK NIKAM Network Talk Show. This is being live video streamed to YouTube. You can, in fact, watch this later on after the interview is over. We're going to post this on Facebook and other places where you will be able to watch the entire interview in your time. Okay, you also mentioned before we started the discussion something about ether and opium.
Yeah.
In Ayurvedic medicine. Maybe you can expand on a couple of those items.
Yes, it's ether is the one thing we were saying about the alcohol. The part of the alcohol. The opium is the one thing which we usually use in the pain management.
I see. Yeah.
Even in the some of the digestive disorders, like you can say irritable bowel syndrome and all those places we have used it. But nowadays, because of the narcotic problem, this one the drug abuse thing, so a lot of rules and regulations have come. So we have reduced the usage of the opium and all. But now I saw in Dr. Ravi's clinic, lot of such things are used here with the legal permission. But in India, it's a lot of restrictions are there. So we have reduced the usage of that. But from the long time, it is used in the pain management and the digestive management, digestive disorders management.
That's interesting.
Yeah.
Okay, let's talk about hypertension, which is a very, very common disorder problem in this country. Almost 60% of the, I would say, I don't know, 60% of the elderly population has hypertension.
Okay.
And how do Ayurvedic doctors approach this particular entity?
See, now the hypertension has become like a two type of stuff. One is the lifestyle-induced hypertension. One is actually a disease-induced.
Yeah.
So when it comes to the lifestyle-induced, it can be managed very easily. As everyone knows now, the stress and stress-related disorders are rampant.
Yeah.
So even that comes under the lifestyle disorder itself. So management of the stress itself is the biggest challenge for us. Once you manage the stress, naturally the hypertension can be brought under control. And we have a lot of medicines which works like a calming of the mind, right? And we have a lot of therapies like a Shirodhara we do, and variety of massages we do, which are therapeutic massages we do in Ayurveda. That will help, and a lot of Sarvangadhara, a lot of Pidri chills are there. Then Shashtika Shalipinda Sweda is there. A lot of those things will calm down the body system, and it helps in relaxing, and it reduces even the muscle stress and strain also.
I see. Yeah.
So once that comes down, naturally this comes, and along with that we have some supplements which reduces the hypertension, the readings of the BP also.
Okay, let's address another chronic disease entity, and that is arthritis.
Okay.
A lot of it, especially elderly patients, it looks like it's almost a disease of aging. And how do you approach this? And can you really cure these entities like diabetes, hypertension, or arthritis?
See, saying a cure, it's a very tough job.
Yeah.
Okay, we can't say it as a cure.
No,
because
some people claim, they can cure cancer, that, and everything else. So I don't know if that is realistic, because Ravi is MD just like me. We don't believe that we can cure a lot of maybe pneumonia. We may be able to cure, but beyond that, most of the chronic diseases, we are helping people to live a better quality of life and maybe prolonged life.
No, chronic condition can be brought under control, but cannot be cured. I don't think so.
Yeah.
Okay, but we can see it's a lot of places there is a mention of cure even in Ayurvedic text. But there are some incurable diseases also. When it comes to the autoimmune disease, it's very tough to address the issue. Only thing we can improve the person's life, quality of the life. Even in arthritis, see, that depends on the osteoarthritis, the rheumatoid arthritis, and the degenerative changes in the spine and the other joints. So further degeneration, we can avoid it through Ayurvedic formulations, Ayurvedic herbal supplements, okay, and some of the therapies. The further inflammation, the further degeneration, those can be arrested. But whatever the changes have happened, to reverse it, I don't think it will be possible through us. But I don't know. In future, we may get some medications through that. We have to wait and watch. But as of now, we are doing quite good therapies for the rheumatoid arthritis, osteoarthritis, and even the lumbar spondylosis. Lot of cases we are getting a lot of positive results in that. Only of the few of the therapies.
That's interesting. Ladies and gentlemen, you are listening to NIK NIKAM Network Talk Show, and we are talking about Ayurvedic approach to lifestyle diseases like hypertension, diabetes, arthritis, autoimmune diseases, and even including heart disease. And my special guest is Dr. M.Swamy from Karnataka, Mysore, my hometown actually. It's Bangalore, which is 80 miles from Mysore city, and Ravi Tamarisa, who is a pain specialist. Okay, now let's summarize and say, how does Ayurveda fit into the Western medicine in helping patients with these chronic diseases, which we know neither one of the entities, modalities can really cure this?
See, as I said you in the starting of the talk, because now 80% of the people are using the alternative system of medicine. Only thing is Ayurveda has not given the due respect what is required in the Western
alternative and complementary medicine is a huge market in the United States. And a lot of people go to Mexico if they have a cancer or something, or Europe and Western other places to seek treatment, which the modern medicine cannot give them in terms of cure or even in terms of mental satisfaction. We didn't even talk about the mind, the soul, and all these things which we were talking before the radio talk show started.
Shall I say that?
Yeah, let's
okay.
touch on that.
Yeah, we were saying that what is the Ayurveda believes in the health. Okay, we were saying that even the WHO has accepted that. That it's not only a disease-free state is a health. Okay, Ayurveda goes one step ahead. Ayurveda says that it is not a disease-free state of health. Disease-free state is not a health. The health is all about the perfect equilibrium of body, mind, soul, and sense organs. So it says all the 360 degree of your body is important. It has to be in a perfect equilibrium. Then only we can call it as a perfect health. So to establish that, it requires lot of things to know about a person's individuality. So the Tridosha theory will help us a lot. Then the Panchamahabhuta theory comes into the picture. And whatever the food stuff we eat, whatever the things we take, it is coming from the Panchamahabhuta, which are helping to build those three doshas. So in the day-to-day basis, these three doshas are getting nourished, okay, and they are like pampered in the body. So we have to maintain those equilibrium. So, and in Ayurveda, always we believe 80% diseases, the problem starts with the mind. Okay, but initial days we used to laugh, but now when we are into a business,
even in the Western world, some statistical analysis been shown that 70% of the diseases are psychosomatic. That means they're just perceived in the mind. And that's why they are so difficult to treat, because the medications really help the pain, but if the pain is in your mind, you can't take it out. He knows very well.
And that's what I was going to say. What do we have control on among our body functions? You cannot control the GI tract unless you control your food you eat. You cannot control your cardiovascular system. It is its own thing by reflexes. And the only thing you control is breathing. And that is what Swasa is all about in yoga and meditation. I strongly feel that when you exercise the control on your breath, it controls a lot of things. Autonomic nervous system, for example, thinking process, so many other things are in your hands by controlling your breath. And I realize that when I hear Sri talking about, breathing kriya and all that, the importance of that is that is the only thing you have control on. Your mind wanders off, but with breath, you can control your mind. and that takes away a lot of psychosomatic problems, I believe strongly.
Okay, maybe you can summarize and tell us, how you plan to integrate this complementary, supplementary Ayurvedic approach to modern medical approach in the clinic that you're trying to set up here in Sugar Land area.
That's what because he is expert in the pain management.
Yeah.
So we want to take up the first pain management therapies, along with that some weight management. Then we want to do some de-stress and detox. Then therapeutic yoga courses we want to introduce. Apart from that, we want to do it some of the well-being classes, the awareness programs to the people, how they can manage those three doshas themselves. See, buying car is quite easy, but knowing the engine is quite much more easier for you. Much more easier for you. Okay, so that's what we will teach them, what body you belong to, how you can take care of them at home itself. Okay, and few of the things, if they go out of the way, we are there to support for that. And a lot of herbal supplements we came out with, which supports those three dosha theories and all. And because he's a pain expert, we want to start with the pain, and we want to come out with some research papers out of that, because we are treating a lot of cases in India.
I see,
So here, because there are obligations and there are some limitations to use the medication here, so we are only getting the herbal supplements into a single organic herbal supplements we are getting through a USDA approved channel, and which is helping a lot here. So we are planning to give a complete approach, holistic approach to health and wellness through a lot of varieties of therapies we have. And because it's a 114-year-old brand, we have done a lot of research since so many years. We kept on improvising in our approach to these lifestyle diseases. That too, from 98, I took out the more concentration towards the lifestyle disease management. And to one extent, we able to control those lifestyle disease rampant things. So now we want to introduce through this, and from here we want to expand it to other states and other cities of the USA.
Dr. Swamy, it's been a pleasure talking to you.
Thank you so much.
Tamarisa, and good luck with gentlemen. And maybe we'll get back after a few months and see, how the combination of allopathic and Ayurvedic medicine is helping patients to, one, get better, and two, maybe take less pain pills.
Absolutely, Dr. Nikam. We thank you very much for encouraging us to come today, and we appreciate this analysis of Ayurveda and Western medicine. And I like to sit with you, also talk about traditional pain management available to
one day we'll do
Western medicine today, and how it needs to change.
Ladies and gentlemen, you're listening to Nik Nikam Network Talk Show. I'm Dr. Nik Nikam. If you would like to be a guest on this program, just send me an email at drniknikam@gmail.com, and you can watch all these interviews on YouTube under my blog, Nik Nikam. And until next Wednesday, have a wonderful week. Thank you.